Hello dear students, in this video I have provided solutions for MUHS Winter 2022 Paper 2 BAQ brief answer question. So let's start. Answers to MUHS Winter 2022 Paper 2 brief answer question. So let's see what is the first BAQ, that is question number 2A. So what is the question number 2A? Mention the confirmatory test to diagnose COVID-19 infection. Enumerate other relevant biochemical parameters performed in COVID-19 patient. So this question has two sub-questions. Okay. So first part is you have to mention the confirmatory test to diagnose COVID-19 infection. So during the COVID-19 pandemic, you must have heard the name of the test repeatedly, that is RT-PCR. So what is RT-PCR? So that is nothing but the confirmatory test to diagnose COVID-19 infection. So what is the answer to the first sub question is RT-PCR. But remember, you have to mention the full form. Okay, so full form is reverse transcription polymerase chain reaction. Okay, RT-PCR stands for reverse transcription polymerase chain reaction. So reverse transcription. Okay, so what is reverse transcription? Why it is called reverse transcription? This COVID-19 is caused by SARS-CoV-2 virus. Okay, so it is a single-stranded mRNA virus. So first for RT-PCR, you have to convert that RNA to DNA, and then multiple copies of DNA are made by PCR. Okay, so that is why the name is reverse transcription polymerase chain reaction. Okay, reverse transcription polymerase chain reaction. So this is the first answer to the first sub question, that is confirmatory test to diagnose COVID-19 infection is reverse transcription polymerase chain reaction. Now answer to second sub question, that is you have to enumerate other relevant biochemical parameters which are performed in COVID-19 patient. Now these parameters I have divided into two. Okay, so what are the two subclasses? Inflammatory first and most important are called as inflammatory markers, and others are marker for monitoring. Now remember what are inflammatory markers? So whenever there is a COVID-19 infection, there is a hyper immune response or abnormal immune response from the body, so that create a inflammatory or hyper inflammatory response. So during that hyper inflammatory response, severe several parameters they increase in the body. Okay, so these are called as inflammatory markers. Okay, so again inflammatory markers are the markers or parameters which are increased due to the increased immune response during COVID-19 infection, and there is a hyperimmune response and there is a severe inflammatory response, and during that inflammatory response these markers are elevated, these parameters are elevated in the blood. So these are called as inflammatory markers. Now this can be divided into three: pro-inflammatory cytokines. First is pro-inflammatory cytokines, second biochemical markers of inflammation, and third biomarker for blood clotting. Okay, so pro-inflammatory cytokines, markers for inflammation and marker for blood clotting. So which are the pro-inflammatory cytokines? Interleukins. Okay, pro-inflammatory cytokines. So during the inflammatory response the cytokines are increased in the blood. Okay, so which are the cytokines which are increased, which are pro-inflammatory cytokines which are increased during COVID-19 infection? These are interleukin 6, interleukin 10 and TNF alpha, that is tumor necrosis factor alpha. Okay, so IL-6 was a very important test during the COVID-19 pandemic, which was done by the biochemistry clinical laboratory. Okay, so IL-6, okay, IL-10 and TNF alpha, interleukin 6, interleukin 10 and tumor necrosis factor alpha. So these are the pro-inflammatory cytokines. Second subclass, marker for inflammation. Now here itself the COVID-19 during when the person get COVID-19 infection, there are inflammation, there is a inflammation, and due to this inflammation these markers are elevated. Which are the marker for inflammation? Ferritin. Okay, so you all know about the ferritin. Okay, it's a storage form of iron, but it is also the marker for inflammation. So ferritin, procalcitonin, CRP. Okay, these are acute phase protein. This is acute phase protein, C-reactive protein, and erythrocyte sedimentation rate (ESR) or erythrocyte sedimentation rate. So CRP, ferritin, procalcitonin, and ESR. These are the markers for inflammation. Procalcitonin indicate the sepsis. Okay, it indicates severe infection, that is severe infection, that is called as sepsis. So sepsis, procalcitonin is a marker for sepsis. Okay. So ferritin, procalcitonin, CRP, C-reactive protein or ESR and ESR. These are the markers for inflammation. And then biomarker for blood clotting is D-dimer. What is D-dimer? It is a degradation product of fibrin. Okay, it is a degradation product of fibrin. What it indicates? It indicates hypercoagulable state. Okay, it indicates hypercoagulable state. So in the COVID-19 patient, there was a chance of myocardial infarction. Okay, or there is a hypercoagulable state all over, and due to thromboembolism, patient can have myocardial infarction or a stroke. Okay, so this was a very important biochemical marker during COVID-19 infection. So it indicates what? That there is a hypercoagulable state. So D-dimer is a degradation product of fibrin. It indicates hypercoagulable state. Okay, so these are the inflammatory markers. These are the inflammatory markers. Okay, now what are the markers for monitoring? Monitoring means when the patient is admitted and whether and you are the physician is giving the treatment, and we have to monitor the treatment whether the patient is responding to treatment or it is getting severity is increased day by day. So we have to monitor whether the patient is responding or not. Okay, so that is marker for monitoring. Also whether this COVID infection is progressing or not. Okay, for that you have to monitor, and the markers for monitoring are routine marker you are all aware of. Okay, these are routine markers. So these patients during COVID-19 pandemic, these COVID-19 patients have tendency for heart failure. Okay, so immediately whenever the patient is admitted and there are some criteria, so you have to test for troponin, CKMB. Okay, these are the routine tests which are done. Myoglobin is nowadays rarely done. So cardiac markers, troponin, CKMB, you all know about this. So these are the cardiac marker. Hepatic marker, again, there are chances during COVID-19 infection, patient may have hepatic failure. So you know the liver function test. Just mention liver function test, different liver function tests. You are all aware of AST, ALT, GGT, LDH, and total bilirubin. Okay, renal. Okay, again, patient can have renal failure. So you know the RFT, most important RFT, you have to estimate creatinine and urea. Okay, now if the patient is very severe, okay, for example, is on ventilator and ICU setup is required. So in that case, there are markers for critical care. ABG is a life-saving test. Okay, so ABG analysis and electrolyte analysis. These are very important markers during the monitoring of COVID-19 patient. And routine urine test, you know, you already must have done your practical. So different urine parameters like pH of the urine, presence of proteins, presence of ketones in the urine to measure the specific gravity of the urine. Okay, so these are the routine parameters which are used for the monitoring of the patient. Okay, whether he is responding or not, whether the severity of COVID-19 infection is increasing or decreasing. For that, you have to monitor the patient. So these are the markers for monitoring. Now, if you go back to the question, they are asking about the relevant biochemical parameter performed in COVID-19 patient. So you must write these inflammatory markers first, followed by these markers for monitoring, because specifically they are asking for parameters performed in COVID-19 patients. So don't miss these inflammatory markers. Okay, at least 2 or 3 parameter or you must remember, followed by the markers for monitoring. You already know this, but these parameters you can't miss because these are specific for COVID-19. Okay, these are very specific. These are the inflammatory markers. Okay, just or if you want to, if you don't remember these sub classification or subclasses like pro-inflammatory, inflammation marker or blood clotting marker, you can just write inflammatory markers and enumerate this: IL-6, IL-10, TNF alpha, ferritin, PCT, procalcitonin, CRP, C-reactive protein, ESR, and blood clotting biomarker is T dimer, and then followed by routine markers: cardiac, hepatic, renal, urine test, and your critical care markers. Okay, so this is how you have to answer. Okay, so confirmatory test is RT-PCR, reverse transcription polymerase chain reaction. You will get and followed by relevant biochemical parameters. We have to mention some important inflammatory markers followed by routine markers. So if you write this, you will get 2 out of 2 marks. Okay. Next question, we will move to the next question, that is question number 2B. Explain the metabolic role of glycine. Okay, explain. Now this is explain. Word is explain. Explain the metabolic role of glycine. So we will see the metabolic role of glycine. So first metabolic role is synthesis of different compounds. Synthesis of biologically important compounds. Which are the compounds which are synthesized by glycine? C4, C5 and N7 of the purine ring. Okay, C4, C5 and N7 of the purine ring. Then heme synthesis, you know, first step is succinyl-CoA plus glycine. Okay, the first step of heme synthesis. Glutathione is important tripeptide, that is name is gamma glutamyl cysteine glycine. So it contains glycine. Creatine, you know, okay, 3 amino acids which are required for creatine synthesis: glycine, arginine, and methionine. Okay, now this itself this itself can be a BAQ. Okay, there are 4 parameters. You have to write half marks for each, and you will get 2 out of 2. So though this itself can be another BAQ. So or it can be also asked in the Viva. So which important compounds are synthesized by glycine? Purine, C4, C5, N7 of the purine ring. Heme, that is first step of heme synthesis, succinyl-CoA plus glycine, glutathione, and creatine. These are the important compounds synthesized by glycine. Synthesized from glycine. Now, what is the other role? Now, next move to the next role. Next role, it is a conjugating agent. Glycine is a conjugating agent. What it conjugate? It conjugate bile acid. Okay, it conjugate like deoxycholic acid. So it conjugate bile acid, and also you must have estimated hippuric acid in normal urine examination in practicals. So what is hippuric acid? It is a detoxification product of benzoic acid along with the glycine. Okay, benzoic acid plus glycine form hippuric acid. So you already performed the detection of hippuric acid in normal urine. So just you have to recall whenever you are answering anything. You must have read this purine ring synthesis, heme synthesis, then biologically important peptide glutathione. What is the name of glutathione? What are the amino acids which are contained in the glutathione? You must have read about creatine also. Which amino acids are required for creatine synthesis? Here you have to just recall it, okay, and collect to make it an answer. So which are the so this is the synthetic. These are the compounds which are synthesized. Next role, conjugating agent. What is conjugate? It conjugate bile acid, and it is used for detoxification of benzoic acid to form hippuric acid. Okay. Next role is a neurotransmitter. But which type of neurotransmitter? It is an inhibitory neurotransmitter. Remember, glycine is an inhibitory neurotransmitter. How it acts as an inhibitory neurotransmitter? It opens the chloride channel. Okay, it opens the chloride channel. So due to which it acts as a inhibitory neurotransmitter. Now it is amino acid. So it is present in collagen, and it stabilizes the triple helical structure of the collagen. Okay, stabilization of triple helical structure of collagen. So if you remember the collagen structure, every third amino acid is glycine. Okay, every third amino acid is glycine. Okay, so stabilization of collagen structure. Collagen has a triple helical structure. So it is present in collagen, every third amino acid in collagen, which is a part of extracellular matrix. So collagen, every third amino acid in collagen is glycine. So it stabilizes the triple helical structure of the collagen. It contributes to one carbon pool by forming methylene tetrahydrofolic acid. Okay, it contributes to one carbon pool also. Okay, How? By forming methylene tetrahydrofolic acid. Okay. Now it is an glucogenic amino acid. Okay, so it is channeled to gluconeogenesis by converting into serine. So glucoglycine get converted to serine, serine to pyruvic acid, and it get channeled to gluconeogenesis. Okay, so these are the metabolic role of glycine. Okay, so it is a 2-mark question. Write these first 4. Okay, remember 4, any 4. But whenever you are writing in the exam or whenever you are answering in the viva, remember when you are listing something, your answer should be from most important to least important. Okay, most important role to least important role. For example, when you get in practical estimation of serum creatinine, so what are the causes of increased serum creatinine? First you have to mention kidney disorders. Okay, not muscle dystrophy as a first cause, no. Okay, so similarly when you are answering anything, always remember to answer from most important to least important. Okay, so to revise, what are the metabolic role of glycine? Synthesis of compounds. Which are the compounds? C4, C5 and N7 of urine ring, heme, glutathione, creatine. Okay, next role is conjugating agent. What it conjugate? Bile acid, and it is used for detoxification of benzoic acid to form hippuric acid. It acts as an inhibitory neurotransmitter. It is present in collagen and stabilizes its triple helical structure. It contributes to one carbon pool by forming methylene tetrahydrofolic acid, and it is a glucogenic amino acid. So it is channeled to gluconeogenesis. Okay, so these are the important metabolic role of glycine. Okay. So question 2C, which water soluble vitamin is used as hypolipidemic drug and what is the mechanism? Okay, during vitamin you must have studied one vitamin which acts as a hypolipidemic drug, and we will see the mechanism. So which vitamin? It is a niacin. Okay, vitamin is niacin. So again there are two sub questions to this question. Okay, we have to mention the name and you have to write the mechanism. Okay, so this is a hypolipidemic drug. Niacin is used therapeutically as hypolipidemic drug. Now we will see the mechanism, how it acts as a hypolipidemic drug. Okay, so mechanism is it decreases the synthesis of VLDL, okay, which is a precursor of LDL. Okay, so what it does, it decreases LDL level first. Okay, decreases LDL level. How? By decreasing the synthesis of VLDL, and you know VLDL is a precursor of LDL. Okay, VLDL is a precursor of LDL. So LDL synthesis is decreased. But what is the mechanism by which the VLDL synthesis is decreased? What is the mechanism? That is next. That is, it decreases, niacin decreases mobilization of free fatty acid from adipose tissue. Okay, so that is very important. This line, this sentence should be there when you are writing the mechanism. Most important is it decreases, niacin decreases mobilization of free fatty acid from adipose tissue. Now you know adipose tissue contains free fatty acid. Okay, so what happens if there is a decreased mobilization of free fatty acid from adipose tissue? There will be the decrease in the level of triglyceride. How? Because triglyceride contains glycerol plus free fatty acid, right? Triglyceride means glycerol plus free fatty acid. So if there are no free fatty acid or decreased quantity of free fatty acid, so obviously it will decrease the triglyceride level. It will decrease triglyceride level. Okay, so and if there is a result decrease in triglyceride level, so there will be the decrease hepatic synthesis and triglyceride content of VLDL, because now VLDL, what is the content of VLDL? Is it contains triglyceride. Okay, it contains triglyceride. So if triglyceride are decreased, that means synthesis of VLDL is also decreased. Hepatic synthesis of VLDL is also decreased. On the top of that, the triglyceride content of VLDL will be decreased. Okay, triglyceride content as well as the synthesis of VLDL is decreased. Now, what happens if VLDL is decreased? Your LDL will decrease. Okay, so that is the mechanism. Again, I am repeating, what is the mechanism? First, you have to mention that decrease It decreases the mobilization of free fatty acid from adipose tissue. That is the most important thing. Decrease mobilization of free fatty acid from adipose tissue. So what happens due to this? There is a decrease in TG level. Triglyceride contains what? Free fatty acid plus glycerol. So if free fatty acids are less, that means triglyceride is also less. So decrease in the triglyceride level. What happens if triglyceride level is decreased? This triglyceride is required for synthesis of VLDL because VLDL itself contains triglyceride. VLDL contains triglyceride. So if triglyceride levels are decreased, that means the synthesis of VLDL will decrease. Also, the triglyceride content of VLDL will decrease. So what happens if the hepatic synthesis of VLDL is decreased? The precursor, okay, VLDL is a precursor of LDL. Okay, so due to decreased VLDL, LDL level will also decrease. Okay, LDL level is also decreased. So that is the first mechanism. Okay, that is the first mechanism. Most important line here is decreased mobilization of free fatty acid from adipose tissue. Okay. Next mechanism, increase of the HDL level. It increases HDL level by enhancing reverse cholesterol transport. You know the reverse cholesterol transport, and HDL is a good cholesterol. Okay, so it transport cholesterol from peripheral tissue to liver. So that is why it is called as good cholesterol, and that transport is called as reverse cholesterol transport. So increases HDL level and enhances reverse cholesterol transport. Next mechanism, lowering of the lipoprotein A level. It lowers lipoprotein A level by decreasing the synthesis of ApoB100 protein, LPA, small a. Okay, you have to mention this small a in bracket. Okay, lipoprotein A is decreased. Okay, how? Because for synthesis of lipoprotein A, there is a requirement of ApoB100, apoprotein B100. So yes, as production of ApoB100 is decreased, lipoprotein A, which has a role in atherogenesis, so it also lowers. It get also lowered. Okay. So to summarize, what happens? What is the mechanism? It decreases VLDL synthesis. So due to decrease in VLDL synthesis, your LDL level get decreased. And how VLDL synthesis decrease? Because decreased mobilization of free fatty acid from adipose tissue. Decrease free fatty acid, decrease TG synthesis, decrease TG content in VLDL, and decrease its synthesis. So decrease VLDL lead to decrease LDL. Okay. Other mechanism. So how? By decreasing TG level. Okay, it also decreases lipoprotein A level, small a level, and it increases HDL level. So this is the mechanism by which niacin acts as a hypolipidemic drug. Okay, so this much you have to write. Okay, so this, to summarize, this will be enough. Okay, decrease VLDL lead to decrease LDL, decrease triglyceride level, decrease LPA, small a level, and increase of the HDL. So this is the mechanism by which niacin acts as a hypolipidemic drug. Okay. So next is 2D. Enumerate two common diseases included under newborn screening program. This is a very new question, and as such in India there is no newborn screening program as such, but screening are done in some hospitals, but under, just like we have national immunization schedule where all schedule is provided at which year which vaccine should be given, but such a newborn screening program doesn't exist in India. But some diseases are there which are which can be undertaken for newborn screening. Okay, and some one or two study is was done in the South India, and they have found that these disorder need to be screened. Okay, so we will see the list. Also, even if they have mentioned two common diseases, but I have provided a list in which by where you can remember some diseases which are included, which can be included actually in the newborn screening program. So first is very important, that is congenital hypothyroidism. This screening, why the screening is important? It will decrease the morbidity in future, morbidity. So screening should be done within the first week after birth, so that your morbidity or long-term mortality can be decreased. Okay, so first disease is congenital hypothyroidism. Okay, so it should be diagnosed during after the first week after the birth. Okay, it should be diagnosed within first week after the birth. Within the first week after birth, this screening program should be done. So congenital hypothyroidism, congenital adrenal hyperplasia, G6PD deficiency, biotinidase deficiency, galactosemia, phenylketonuria, maple syrup urine disease, homocystinemia, and last one is the cystic fibrosis. Cystic fibrosis. Okay, so first one is very important, congenital hypo. This first two are very important. Okay, congenital hypothyroidism, congenital adrenal hyperplasia. It is CAH. You can remember. Okay, CAH. Congenital hypothyroidism, congenital adrenal hyperplasia, glucose 6-phosphate dehydrogenase deficiency, that is G6PD deficiency, biotinidase deficiency, galactosemia, phenylketonuria, MSUD, that is maple syrup urine disease, homocystinemia, and cystic fibrosis. So these are the diseases which can be or must be included under newborn screening program, which should be screened within the first week after birth. Okay, so whenever you're writing or whenever there is a list in the any book or where so in the book or when you are answering during viva or when you're writing the answer and you're writing a list, so most important should be your first and least important should be your last. Okay, most important to least important. Okay, so congenital hypothyroidism should be there because they are asking about two diseases. So you should not write the least common diseases. Okay, which are needed to be included under newborn screening program. So congenital hypothyroidism should be there. Congenital adrenal hyperplasia should be there. Okay, and then you can write this G6PD deficiency, biotinidase deficiency, galactosemia, phenylketonuria, maple syrup urine disease, homocystinemia, and cystic fibrosis. Okay. So these are the common diseases which are which are included under newborn screening program. Okay. So let's see the next. Next question, write the role of ferritin and transferrin. Write the role of ferritin and transferrin. Okay, now these are involved in iron metabolism. Ferritin, transferrin, these are involved in metabolism of iron. So we are divided into role of ferritin and role of transferrin. So what is the role of ferritin? First, in the intestinal mucosal cells, okay, this ferric ion, ferric form of the iron combines with apoferritin to form ferritin, and in the mucosal cell of the intestine, it acts as a temporary storage. Okay, it acts as a temporary storage. So this is a ferritin is a temporary storage in the intestine. It is a temporary storage in the intestine. Okay. Now also after it get iron get transferred to the transferrin, so it is a ferritin, it's a storage form of iron. It is here, it is also stored, it is also stored, iron is also stored in the intestine, but is a temporary storage. Again ferritin is involved for temporary storage, and for long term storage again in liver, spleen, and bone marrow. It is the storage form of iron in liver, spleen, and bone marrow. During the absorption and during absorption, it is iron is stored temporarily in the intestine in the form of ferritin, and for long term, it is stored in liver, spleen, and bone marrow. Okay. Third, just we have seen in COVID-19 first BA question number 2A. Now they are not mentioned the role of question is not like that. Write the role of ferritin and transferrin in iron metabolism. So you can mention this also. Okay, ferritin is acute phase reactant protein which is increase in inflammatory diseases. For example, in COVID-19, just we have seen for the answer of COVID-19 biochemical markers for COVID-19 and that inflammatory marker ferritin. So ferritin is an inflammatory marker for COVID-19. Okay, so these are the role of ferritin. First, so ferritin means just remember it's a storage form. Okay, ferritin is a storage form and transfer is a transport form, as the name suggests, transferrin. So it transport the iron. So it is a transport form, and ferritin is a storage form. Okay, but you have to mention temporary storage in intestine during the absorption. Okay, this iron is stored in the ferric form in the intestine with the help of ferritin, and also in long term it is stored, iron is stored in liver, spleen, and bone marrow. It is stored in liver, spleen, and bone marrow. Now you can mention here also it is a during COVID-19 it is increased because it is a acute phase reactant protein. Okay, this is the role of ferritin. What is the role of transferrin? As the name suggests, transferrin, transfer, it is a transport form of iron. It is nothing but a transport form of iron. So ferric form of iron in the plasma binds with the transferrin. Okay, ferric form bind with the transferrin. We transport the iron in the blood. We transport the iron in the blood. Each transferrin molecule can bind two atoms of ferric iron. And last one is you have to mention TIBC, that is total iron binding capacity. Total iron binding capacity. So ferric transferrin binds with the 400 milligram per deciliter of the iron in the plasma. Okay. Now this is called as total iron binding capacity. This is called total iron bind. So in the nutshell, just remember, or you already must have known when you have studied the iron metabolism, that ferritin is a storage form and transfer is a transport form. Transferrin is a transport form. So where how to write? As they have mentioned role of ferritin, they have asked role of ferritin and transferrin. So first write role of ferritin and then write role of transferrin. So role of ferritin, temporary storage. So it is storage form. So temporarily it is stored in intestine, and for long term it is stored in liver, spleen and bone marrow. Okay. In addition to role in iron metabolism, it is also acute phase reactant protein, so it is increasing inflammatory diseases like COVID-19. What is the role of transferrin? It transport. What it transport is a transport form of iron. How much this was one transferrin molecule combined with the two atoms of ferric ions. Okay. Now ferric form of iron binds with the transferrin and which transport iron in the blood. Next, you have to mention TIBC, total iron binding capacity. So, transferrin molecule binds with the 400 milligram per deciliter of iron in the plasma. So, this binding is called a total iron binding capacity. Okay, so this is the role of ferritin and transferrin. Ferritin is a storage form, transferrin is a transport. Okay, so let's see the next. So next question is enumerate any four enzyme activated by calcium. So very straightforward question. Write four enzyme, half mark for each enzyme, and you get 2 out of 2 mark. Okay. So to remember it, it start from A, adenyl cyclase. Okay, it's the most important enzyme activated by calcium. So don't miss this enzyme. So just like your ABCD, you can remember A. Then there is no B, but there is a, as there is a calcium, so there is a C. Okay, so for same calcium dependent protein kinase and calcium magnesium ATPase. Okay, calcium dependent protein kinase and calcium magnesium ATPase. So you have A, then to C, then comes G. Okay, glycerol 3 phosphate dehydrogenase, glycogen synthase. Okay, these are 2G and then 3P. Okay, 3P. So, which are the 3P? Phospholipase C, phosphorylase kinase, pyruvate carboxylase, and lastly myosin kinase. So, A is stands for adenyl cyclase, then two enzymes which are starting from calcium itself. But enzyme is protein kinase. Okay, so which protein kinase? Calcium dependent protein kinase. Third enzyme is ATPase. Which ATPase? Calcium magnesium ATPase. Okay, so 2C. Then comes your 2G. 2G glycerol 3 phosphate dehydrogenase and glycogen synthase. Then comes 3P. Which are the 3P? Phospholipase C, phosphorylase kinase and pyruvate carboxylase. Okay. So remember any four enzyme. Okay. So it's just like ABCD, start from A, adenyl cyclase, two enzyme by that start from calcium, calcium dependent protein kinase and calcium magnesium ATPase. Then 2G, that is glycerol 3 phosphate dehydrogenase, glycogen synthase, and 3P, phospholipase C, phosphorylase kinase and pyruvate carboxylase. Okay, and lastly there is another enzyme, that is myosin kinase. Okay, so very straightforward question. Okay, just write four enzyme and get 2 marks. Okay, let's see the next question. That is question number 2G. What is 2G? Write the commonest example of point mutation related to hemoglobinopathy. Okay, point mutation related to hemoglobinopathy. So it is not a straightforward question, it is some twisted one. Okay, so what is the commonest example of point mutation which is related to hemoglobinopathy? Is nothing but a sickle cell anemia. Okay, sickle cell anemia. Answer is sickle cell anemia. But here there is no specific sub questions which are asked about sickle cell anemia, and also you cannot write the just sickle cell anemia and you will get 2 marks. So this is somewhat tricky question. You have to name the disease, that is sickle cell anemia. Also, there is no mention what you want, what is expected to write about sickle cell anemia. What is expected to write? Okay, so I have just briefly given you the solution about this. Okay, first you have to write the commonest example is sickle cell anemia, and it is specifically written that point mutation. So what is point mutation that is happening in the sickle cell anemia that you should mention? Okay, so commonest example of point mutation related to hemoglobinopathy, sickle cell anemia, and you have to explain now what is the point mutation which is occurring. So what is sickle cell anemia? It is due to production of sickle cell hemoglobin. Okay, how sickle, now we will proceed how sickle cell hemoglobin is produced. So what is happening? Glutamate at 6 position of beta chain of hemoglobin is replaced by valine. Very easy to remember. Glutamate at 6 position of beta chain of hemoglobin is replaced by valine. Glutamate is replaced by valine. Now just you have to draw this. Okay, what is the point mutation here? If you consider, if you concentrate on RNA, the GAG is mutated to GUG, that is A to U. Okay, GAG is changed to GUG. So you must write this. Okay, because they are asked about the example of point mutation. Okay, so you must write this. Okay, so glutamate at 6 position of beta chain of hemoglobin replaced by valine. Okay, so DNA to RNA to, then RNA is translated to amino acid. So glutamate is changed to valine or replaced by valine. So this is normal HbA, that is adult, and this is sickle hemoglobin or sickle cell hemoglobin. So HbA and HbS. Okay, now this much you have to write, but other, again I am repeating, no, not mention what you have to write. Okay, so just I have just provided the solution about in brief about sickle cell anemia itself. What is sickle cell anemia? This is just the biochemical basis and point mutation. So what is it? Sickle cell anemia. What is happening in HbS? Glutamate is hydrophilic amino acid. Okay, glutamate is hydrophilic. It is replaced by hydrophobic valine. Okay, it is relatively hydrophobic as compared to glutamate. It is replaced by valine. So due to this, that is replacement of hydrophilic amino acid by hydrophobic amino acid, there is decrease in the solubility of HbS, which leads to polymerization of hemoglobin inside the RBCs. Okay, so hydrophilic is replaced by hydrophobic. So solubility of HbS is decreased, and there is a polymerization of Hb molecule, hemoglobin molecule inside the RBC. So due to this polymerization, that causes the distortion of RBC into sickle shape, which makes them fragile, and there is a tendency for hemolysis, tendency to hemolysis. So that's why as the RBC shapes are changed to sickle shape. So that is why it is called sickle cell anemia. What is the mechanism of sickling? Just in brief, because question is not specifically asked, just like previous question, like just mention 4 enzyme and get 2 marks. So just in brief, you should write this. Okay, so what is the mechanism of sickling? What happens in D? Always remember. Okay, sickle cell anemia can be asked in your SAQ also. Okay, for 5 marks. So always remember, sickling occurs in deoxygenated state. Okay, it occurs in deoxygenated state. So in deoxygenated state, HbS shows protrusion on one side and cleft on other side. It shows protrusion on one side and cleft on other side. Due to this, there is a protrusion of one molecule fitting into the cleft of adjacent molecule, and there is a formation of long chain of deoxygenated HbS, and this long fibrous precipitate distort the RBC into sickle shape. Sickle shape. Okay, so that much we have to write, because as I mentioned, non-specific, there is no specific sub question which are asked. Whatever they have mentioned is what is the example of point mutation which is related to hemoglobinopathy. So if you can't escape by writing sickle cell anemia, so what you have to write? Point mutation. Okay, glutamate is replaced by valine at the 6th position of the beta chain of hemoglobin. Okay, in short, mechanism of sickling, and why there is a sickling? Hydrophilic amino acid glutamate is replaced by hydrophobic. So there is a decrease in the solubility of HBS. Okay, that leads to distortion of RBC into sickle shape and tendency to hemolyze. Polymer this sickling occurs in the deoxygenated state. Why? Because in deoxygenated state there is a protrusion on one side and cleft on other side. So protrusion of one molecule fits with the cleft of the adjacent molecule, and there is a long chain of deoxygenated HBS which is produced. Okay, so there is a fibrous that causes long fibrous precipitate. Okay, and there is a distortion of RBC into the sickle cell. Okay, so that is more than enough for 2 marks. Okay, more than enough for 2 marks. Name of the disease, or that is name of the example, where example of hemoglobinopathy which is related to point mutation. As and what is the point, what you have to write, what is the point mutation. Okay, then why you should write this, because it is not mentioned what is expected. So just write what is the mechanism of sickling, what happens due to change in the amino acid sequence. Okay, so that is more than enough for 2 marks. Okay, next let's see the next question. Next question is very easy, again straightforward. Enumerate any four proteins produced using recombinant DNA technology. This is very important topic. Recombinant DNA technology is very important topic. There can be SAQ, BAQ on this. So enumerate four proteins. So most important is insulin, which is used for in the treatment of diabetes, growth hormone for growth disorder, clotting factor 8 for treatment of hemophilia A. You can also write it at clotting factor 9 for treatment of hemophilia B. Urokinase, you know the use of urokinase for the lysis of the clot. Alpha 1 antitrypsin for the treatment of emphysema. Superoxide dismutase, okay, for to reduce the oxidation stress. Albumin for the treatment of hypoalbuminemia. Erythropoietin for the in the treatment of chronic kidney diseases. Calcitonin and ACTH. Okay, calcitonin for and ACTH for rheumatic disease. Okay, so these are the proteins which are produced using recombinant DNA technology. So start from very common, that is insulin. Already you know, when you read about recombinant DNA technology in the any textbook, first example is always insulin. So you must remember insulin, or it is by default it is remembered by almost 90% of the student, that is insulin. Okay, then there are some other examples of protein which are produced by recombinant DNA technology: growth hormone, clotting factor 8, urokinase, alpha 1 antitrypsin, superoxide dismutase, albumin, erythropoietin, calcitonin, and ACTH. Okay, calcitonin for osteomalacia. Okay, calcitonin and ACTH. So these are the proteins which are produced using recombinant DNA technology. Remember any four. Okay, there are the various proteins other than these list. Various proteins are also there. You can remember. Ne Next question. Name any four heme-containing protein. Very easy, very straightforward. There are, which are the heme containing protein: hemoglobin, myoglobin, different cytochrome like cytochrome B, C1C, and enzyme. Which are the enzyme? Peroxidase, catalase, and nitric oxide synthase. These are important to remember in MCQ also. Okay, which of the following enzyme is heme containing? So peroxidase, catalase, nitric oxide synthase. Okay, so these are the four protein which contains heme. So hemoglobin, very easy. Hemoglobin, myoglobin, different cytochrome, and enzyme, peroxidase, catalase, and nitric oxide synthase. Okay, so these are the heme containing protein. Very straightforward. Just write four names and forward. You get 2 out of 2 mark, and save your time for SAQ and LEQ. Let's see the next question. That is 2J. What is it? Deficiency of ornithine transcarboxylase causes orotic aciduria. This is a statement and you have to explain why deficiency of ornithine transcarboxylase causes orotic aciduria. First, I want to state that is I think there is a trans in place of trans carboxylase there should be trans carbamylase. Okay, it should be trans carbamylase. There is no such a enzyme which is that is trans carboxylase. Okay, there is a difference between trans carboxylase and trans carbamylase. Trans carboxylase transfers carboxyl group, whereas this trans carbamylase will transfer carbamyl group. Okay, so I assume that this should be the ornithine transcarbamylase. Okay, ornithine transcarbamylase. So what happens? Why deficiency of ornithine transcarbamylase causes orotic aciduria? Now remember what is this? Where this enzyme takes part in your in the which pathway there is a role of this enzyme is, so which is the pathway that is urea cycle. Okay, this enzyme plays an important role in urea cycle. So this is urea cycle and it is present in the mitochondria. Okay, the first steps that occurs in the of urea cycle occurs in the uh, mitochondria. So enzyme is ornithine transcarbamylase. Ornithine transcarbamylase. What it transfer? It transfer carbamyl group. It transfer carbamyl group from carbamyl phosphate to ornithine to form citrulline. Okay, it transfer carbamyl group from carbamyl phosphate to ornithine to form citrulline. Okay, this is first. This is a step in urea. Second step in urea cycle. Okay, so what happens if there is a deficiency of this enzyme? You can see very easy. If the deficiency of this enzyme is there, what will happen? Carbamyl phosphate level will increase. Okay, carbamyl phosphate level is increase. Okay, now what happens if the carbamyl phosphate is present in very large amount? Okay, now this is present in mitochondria. It will goes into the cytosol. From mitochondria it will go into cytosol. For what? It will be used for the synthesis of pyrimidine. Okay, it will be used for synthesis of pyrimidine. So this is the pyrimidine nucleotide synthesis. So you can see here it is carbamyl phosphate is required here. Okay, this is occurring in the cytosol. Remember this. Okay, this is occurring in the mitochondria and pyrimidine synthesis is occurring in the cytosol. So this carbonyl phosphate will be channeled for pyrimidine synthesis. So synthesis of pyrimidine will increase. What happens if the pyrimidine synthesis is increased? There will be the increased production of orotic acid and its excretion will be increased. Very easy. Okay, orotic acid or orotate will be increased and there will be the increased excretion of orotic acid through the urine. So what is this condition is called as orotic aciduria. Very easy. Okay, so this is also called secondary orotic aciduria. It is also called secondary orotic aciduria. Okay, so why deficiency of ornithine transcarbamylase? Okay, not carboxylase. Why deficiency of ornithine transcarbamylase causes orotic aciduria? Ornithine transcarbamylase is an enzyme that transfer carbamyl group from carbamyl phosphate to ornithine to form citrulline during urea cycle. Okay, what if the ornithine transcarbamylase is deficient? Amount of carbamyl phosphate will increase. Okay, increase amount of carbamyl phosphate will be going from mitochondria to cytosol where it will take part in the formation of pyrimidine. So synthesis of pyrimidine will be pyrimidine nucleotide will be increased. Synthesis of pyrimidine nucleotide will be increased. So increase synthesis, increase production of uric acid, increase production of orotic acid. Increased production of orotic acid means increase excretion of orotic acid through the urine, and this condition is called as orotic acid urea. It is secondary orotic acid urea. Okay, understood? So very easy. Why deficiency of ornithine transcarbamylase causes orotic acidity. Okay, so you can draw flow chart. There is no need to. This is I have just taken for your better understanding. No need to draw this. No need to draw this. You can draw a flow chart here. Okay, you can. This flow chart will be enough to score 100% mark. Okay, why? It's a self-explanatory. Okay, you don't have to write a description. What happens? First step, deficiency of ornithine transcarbamylase causes increased carbamyl phosphate. It will enter into cytosol. It will channel for pyrimidine biosynthesis. So pyrimidine biosynthesis will be increased. That will causes increased production of orotic acid, and there will be the increased excretion of orotic acid, which is called orotic, and that will cause orotic aciduria. Okay, so this is the answer. So next, let's see the next question. Write sources of carbon and nitrogen atoms for de novo synthesis of pyrimidine nucleotide. Very easy. Okay, don't miss this. Both sources of purine ring and pyrimidine nucleotide ring you must know. Okay, very easy. Very good if you draw such a diagram depicting the various sources. Okay, so N1, C4, C5, C6, C4, C5, C6, and N1 from aspartic acid. Okay, N1, C4, C5, C6 from aspartic acid or aspartate, C2 from CO2, and N3, that is nitrogen 3, from glutamine. Okay, it is enough if you draw this diagram, no need to write. Okay, so it is also asked quite frequently in the MCQ also. Okay, like C4 of the pyrimidine nucleotide is contributed by. Okay, so what is the source of C5 in nucleotide, pyrimidine nucleotide? Okay, so you must remember the sources for both purine and pyrimidine nucleotide ring. Okay, so again to revise N1, rather than mugging it, if you have visual impression, okay, very easy to remember this part on. Okay, just half of this purine ring, or more than half I will say. Okay, so by aspartic acid. Okay, N1, C4, C5, C6 aspartic acid, C2 from CO2, and N, that is nitrogen 3, N3 from glutamine. Okay, so that's it. So thank you.